wondered if it is safe to drink that daily latte or that daily coffee that you have while you're pregnant? It can be very confusing to understand the true data behind caffeine use in pregnancy. So I know it can be a confusing topic, so that's what we're going to talk about today. Welcome to the Dr. Lexi Show, where I take pregnancy topics and break them down as best I can to help you advocate for yourself in your pregnancy. I'm Dr. Lexi, a board-certified OBGYN and maternal fetal medicine specialist, which is just a high-risk pregnancy doctor. And today we're talking about caffeine in pregnancy. So I am a fan of caffeine when I need it, but I will preface this with saying, if you guys don't already know, I do have some heart issues of my own. And we need to make sure that we understand that people with heart issues should not really drink a lot of caffeine, particularly if you have things like a high heart rate or kind of palpitations, something like that. So we're going to focus a little bit on that today. As you know, the way that I kind of design this is we are first going to expand our knowledge on the topic. So one thing I want us to try to look at is what are certain things that have caffeine in it other than just coffee. So when we think about the amount of caffeine that we typically drink, it can be in foods and it can be in drink. So if you think about something that you drink, the most common thing that we end up thinking about is caffeine in coffee. And so one typical 8-ounce cup of coffee has about 100 milligrams of caffeine in it. Now, if you're making coffee at home and you're doing espressos, or if you're ordering a triple shot at the coffee shop or something, obviously that's different. But coffee should be, or is typically around 100 milligrams of caffeine per 8-ounce cup. Now, if you're drinking sodas or something in a can, you can actually look on the back and tell how much is in there. So that's one way to think about it for coffee, for where the amounts are. Now, for other foods and other items, I've listed them here for you so you can kind of take a look at them. And also, don't forget about certain foods. Chocolate does have caffeine in it, and the darker the chocolate, the more caffeine there is in it. Actually, coffee-flavored ice cream still has some caffeine in it too. So first thing I wanted to do was go through kind of some foods that have caffeine in it. Now, what I'd like to do as well for developing a few skills is to try to figure out a couple of answers to a few questions. And so one of the questions that we'd like to look at is it safe to actually drink caffeine or ingest caffeine during pregnancy? The general answer is yes, in small quantities. Now, studies are still ongoing, so we have to be aware of that. And if you'll look, I've provided a couple of links for you to look at some articles. And also there's a link to some frequently asked questions about caffeine if you're interested in learning more. So yes, currently the recommendation is in small quantities, caffeine can be considered safe, and it is not considered something that causes any increased risk for things like birth defects. So the general number that's used is anything less than 200 milligrams per day. And then the second question that we're looking at is there are people that should avoid caffeine, whether they're pregnant or non-pregnant, and those individuals are people kind of like that I was mentioning for myself, those who either have high blood pressure or maybe some type of either heart arrhythmia, where the rhythm of the heart isn't good, heart palpitations, or particularly if the heart beats quickly, because caffeine can cause the heart to beat faster and people to have tachycardia, or sometimes people say they get shaky when they drink caffeine. So that can be a side effect of it. And then the third item that we're looking at here is when can caffeine actually be beneficial? So if you drink caffeine when you're not pregnant and you stop caffeine cold turkey, what can happen is you can have withdrawal headaches, and those can be rather significant. For those who have headaches during pregnancy that may be due to withdrawing from caffeine, if they take medication to help with their headaches, or if they are actually trying to do something to help the headache go away, staying hydrated is super important. The other thing that's very important is that you can also talk to your provider about maybe taking a few sips of caffeine to help with those headaches. Hydration is super important for anybody who has headaches, particularly if you're having lots of caffeine or drinking caffeine at all. Water is a very good thing to keep in the balance of your daily regimen. The next thing we want to look at is how can we develop some skills now that we know the right amount or the amount of caffeine that can be ingested during pregnancy, and what kind of questions can we ask with regard to this information that we have. So one of the main questions is ask your provider if it's okay for you to continue to drink or ingest a certain small amount of caffeine on your daily regimen during your pregnancy. And also ask if you have any contraindications to drinking caffeine. So make sure to ask your provider those questions. Very important to develop those skills. And finally, we want to discuss what kind of impact is this going to have. Super important, because if you know that you can or cannot have caffeine in a pregnancy, how wonderful to know that and to talk to your provider about that. The other thing that I wanted to mention was there are also some caffeines that can be absorbed through the skin. Cocoa butter is one of those things that has caffeine in it, and it can actually be absorbed in the skin. And there have been studies in the past that have shown babies in the womb can have higher heart rates, or even some maybe abnormalities in the rhythm of the heart that could be associated with caffeine exposure through absorption. So just kind of an extra thing, if you're trying to avoid caffeine all around, make sure that you're not using a daily lotion that has any type of cocoa butter in it. So just an FYI on that. So to kind of look at everything we've looked at today, in summary, we have learned about caffeine. We have learned what foods and drinks have certain amounts of caffeine in them. We talked about the amount of caffeine that's generally considered acceptable, which right now is less than 200 milligrams a day. We've talked about things that would be helpful for having caffeine with these caffeine headaches possibly. We've also talked about indications to avoid caffeine, particularly if you have high blood pressure or any type of cardiac issues like irregular rhythms or irregular beats of the heart or high heart rate. Finally, hopefully we have learned a little bit on questions to ask and ways in which to advocate for a happy and healthy pregnancy. I'm Dr. Lexi. We will see you again soon. As always, leave any comments below from today's video that we have, and also anything you'd like to hear in the future about various pregnancy topics.